One of the goals behind Help with Opioid Addiction New York for helping patients is education. A lot of times, doctors just shove medications down their patients' throats, leaving patients confused and wondering what and why they are taking certain medications. Here at Help with Opioid Addiction New York, we want to educate our patients, show our patients we care, and show them we are in this battle together. So that is why we want to create these educational videos, so patients understand exactly what they are taking and why they are taking them. One of the medications we prescribe here is called Suboxone. We use it to treat Opioid Abuse Disorder, or O.U.D for short. You might have heard about it before, and it is a great tool in our arsenal of Medicated Assisted treatments for opioid addiction. Unlike methadone, which is highly regulated by government officials and requires a daily trip to the office for the medication, Suboxone can be prescribed and picked up at the local pharmacy. This was a game changer for addiction medicine because most people suffering from opioid addiction are normal, everyday people. Your neighbors, your friends, your boss, and so on. So making a daily trip to the medical office just to take your medication was a major hindrance for most, if not everyone, suffering from opioid addiction. Suboxone is an FDA-approved drug for treating opioid use disorder. It is the brand name for a combination of two medications, buprenorphine and naloxone, both of which play a role in managing opioid addiction. For people with O.U.D, Suboxone helps control cravings and other uncomfortable withdrawal symptoms such as anxiety, insomnia, sweating, racing heartbeat, nausea, and body aches. This can help prevent relapse and give you the time you need to address your triggers, the people, places, and things that make you want to use, and manage your life while in treatment. How does Suboxone work? Suboxone is a dissolvable tablet or film that you place inside your cheek or under your tongue where the medicine is absorbed. It's ingested and absorbed into the bloodstream. The buprenorphine attaches or binds to and activates the same nerve cells in the brain as other opioids do. These nerve cells are called opioid receptors, and when opioids bind to and activate them, they send signals to the body that cause feelings of pleasure or a high. When buprenorphine binds to and activates opioid receptors in the brain of an opioid-dependent person, it does so much more slowly than other opioids such as heroin and fentanyl. As a result, treatment doses of buprenorphine ease withdrawal symptoms and reduce cravings without the high. The naloxone part of Suboxone helps prevent opioid misuse. If Suboxone is crushed and snorted or injected, the naloxone blocks the effects of the buprenorphine, causing withdrawal symptoms in people who are physically dependent on opioids. Although Suboxone contains an opioid, it should not be viewed as a substitute for opioids that are misused. Rather, it's a safe and effective, evidence-based treatment that helps people recover from O.U.D and regain control over their lives. It's important to note that you shouldn't stop taking Suboxone without a doctor's help, even if you start to feel better. This is because you could have withdrawal symptoms if you suddenly stop taking it. Your doctor will tell you how long you need to take Suboxone, as well as any other counseling and support you may need in treatment. When getting treatment for an opioid use disorder, there are a variety of possible treatment settings. These include inpatient and outpatient treatment. Help with Opioid Addiction New York offers comprehensive rehabilitation services for those seeking recovery from opioid addiction. Suboxone as one of our many tools used to help treat heroin or other opioid addiction. Once again, we want to remind you that the journey to recovery begins with just one step. And if you are watching this video, then it means you already took it. So let us take the rest with you. Please do not hesitate to call or even text our office at 1-888-996-5946 or visit us online at www.helpwithopioidaddiction.com. You can schedule your first appointment right from our website. We offer both in-person and telehealth services. Telehealth is a great way for you to meet the doctor, discuss your options, and, if possible, start your treatment right away. Long-term care will involve you having to come to the office eventually, but if you are looking to take that first step, we want you to be comfortable. And if that means being in your own home the first time, then we want you to feel at ease. Thank you for watching, and let us take the steps to recovery with you.